Mental Health Awareness Training from the RADA Student Wellbeing Service. The aims of the training are to first of all define common mental health issues amongst our students, and to recognise the key signs and symptoms of mental distress. Also to understand the key risk and protective factors associated with mental health difficulties, and to think about how we can best support and effectively communicate with our students to meet their needs, and also know when and how to refer students on for additional help if necessary. First of all, let's think about these three questions. What is mental health? So what does this term actually mean to you? And why are we talking about mental health? Why is it important? Is it important? And thirdly, how can we best support our RADA students with their mental health? What might that look like?
Mental health is not simply us versus them. It's a spectrum that includes all of us, fluctuating over time. Rather than dividing people into groups of mentally healthy and mentally ill, we must recognize that mental health exists on a spectrum that we all experience. Slide 6 is a 3-minute video that describes what it feels like to live with a mental disorder. See the link below to access this YouTube video. There are 4 types of psychiatric categories for mental health problems. These are mood disorders, which include depression and bipolar disorder, anxiety disorders, which include such issues as generalized anxiety disorder, obsessive compulsive disorders. Third category is personality disorders, such as emotionally unstable personality disorder and borderline personality disorder. And the 4th broad category includes psychotic disorders, such as schizophrenia, delusional disorder, drug-induced psychosis. There are obviously many more under these 4 broad categories. The iceberg analogy is a helpful way to understand that there is often more going on underneath the surface than what we can outwardly observe in someone's behavior. Just like an iceberg, the visible part above the waterline is just a small fraction of the whole iceberg. In this analogy, the tip of the iceberg above the water represents a person's observable behaviors. This could be actions, words, body language, etc. But there's a much larger part of the iceberg underneath the water that cannot be seen. This underwater portion represents the thoughts, feelings, beliefs, past experiences, and needs that are driving the visible behaviors we observe. So, for example, if someone suddenly becomes angry and lashes out, that reaction is the visible behavior, or the tip above the water in this analogy. But underneath the surface, that person may be feeling insecure, afraid, stressed, or uncared for in that moment, the larger hidden part underneath the water. Or they may be reacting based on past traumatic experiences, core beliefs about themselves, or unmet needs for safety and understanding. So the whole analogy of the iceberg teaches us to look deeper than surface behaviors and ask what feelings, experiences, and needs might be driving those behaviors. It encourages curiosity, empathy, and compassion when faced with challenging behaviors in ourselves and others. So just like an iceberg, the major reasons for behavior are often hidden below the surface. Mental health difficulties may show up in various ways, like low energy that impairs daily functioning, self-harming behaviors, increased irritability or aggression, changes in sleep, like insomnia or sleeping too much, tearfulness, withdrawal from social activities, and a range of other expressions as we show here on this slide, Recognizing these potential signs and having open conversations is key to supporting students' well-being and connecting them with helpful resources like their GP or the well-being service or the disability service. At RADA, we try to foster a caring community where students feel safe seeking support. The ICD-11 and the DSM-5 are manuals that psychiatrists use to diagnose mental health conditions. The ICD-11 is made by the World Health Organization and is used worldwide. The DSM-5 is made by the American Psychiatric Association, is used mainly in the U.S. Both manuals provide standard criteria so that doctors and psychiatrists can consistently identify disorders like depression, anxiety, ADHD, and more. This can help people get the right treatment. However, there are many criticisms of both the ICD-11 and DSM-5 manuals. Various criticisms, including they focus too much on symptoms rather than causes, and this can lead to overly broad definitions of disorders. With both the ICD, the International Classification of Diseases, and the DSM-5, the Diagnostic Statistical Manual of Mental Disorders, there are various criticisms, particularly the DSM-5, which was the first of these, originally published in 1952 by the American Medical Association. Some of the criticisms have involved the various revisions that lack empirical support, the inter-rater reliability, which is very low, meaning multiple researchers using these criteria wouldn't necessarily arrive at the same diagnoses. The fact that there are several sections that are poorly written and contradictory. Probably one of the biggest criticisms is that the psychiatric drug industry has had a big influence on the manual's content, and that many of the workgroup participants compiling it have had ties to pharmaceutical companies. Risk factors may include lack of social support, bullying, family history of mental illness, financial stress, and perfectionistic tendencies common in young people. Protective factors can include close relationships, family emotional support, staff support, mental health resources at RADA, and an overall culture at RADA that can encourage help-seeking and self-care. By fostering social connection, monitoring student well-being, and providing access to mental health support, RADA staff can help build resilience. Friends and families play key roles in reducing isolation and stigma around mental health issues, identifying risk early and promoting protective community and self-care can prevent crises in populations like RADA students. CORE is an acronym that stands for Clinical Outcomes in Routine Evaluation. The CORE system is a set of forms and measures developed to assess clinical outcomes in routine mental health practice, and it's used widely throughout universities and throughout the NHS. It provides a standardized set of questions and tools for routinely evaluating how well therapy is going throughout the client's sessions. And it can be given at the beginning, at the end of therapy to evaluate the outcome of therapy's effectiveness. It's basically a 10-item self-report questionnaire that students fill out when self-referring to the well-being counseling service. It assesses symptoms like anxiety, depression, trauma, and functioning over the past week that the student is looking back as they fill the form out. Score bands categorize distress from healthy, mild, moderate to severe, to severe. So at the initial counseling assessment, the Core 10 supplements discussion of students' concerns and goals. It provides a baseline, basically, of a well-being benchmark. During counseling, students complete the Core 10 periodically to track progress and they can then have a comparison of scores over time that helps the student and the counselor know if the students are benefiting from counseling and if the support is working. Neurodiversity refers to natural variations in how people think and learn, including conditions like autism, ADHD, dyslexia, and more. RADA students who feel they may have a neurodiverse condition can contact the Disability Service for an assessment to determine eligibility for Disabled Student Allowance. This allowance provides funding for academic support services and equipment. Eligible RADA students are assigned a non-medical helper who offers tailored mentoring, study strategies, time management, organization, and autism support, amongst other skills. Embracing neurodiversity allows diverse minds to thrive at RADA through individualized assistance and an inclusive community. Here are some supportive communication strategies that staff can use with students struggling with mental health. We've listed 4 here: active listening, making eye contact, avoiding distractions, and then summarizing what the student is saying to show that you understand them. Validation, acknowledging the student's feelings and letting them know that it's normal to feel that way in difficult times. Encouragement, pointing out the students' strengths and the progress they're making, showing that you believe in them and in their ability to get through challenges. Problem solving, asking how you can help, brainstorming practical solutions together. Additional communication strategies include having patience to allow students the time it takes for them to open up and not pressing for details that they aren't ready to share. Respect, treating the student with dignity and compassion, not judging or trivializing their experience. Hope, speaking in a way that promotes positivity and giving the student the idea that their circumstances can improve. Confidentiality, reassuring the student that you'll maintain their confidentiality. The Student Wellbeing Service at RADA is comprised of 2 teams, the Counseling Service and the Disability Service. Counseling provides ongoing brief and drop-in counseling. Disability services include support for neurodiverse students and those with mental health conditions, learning disabilities, autism, and enabling students to access Disabled Student Allowance. Together, the teams offer comprehensive support for student well-being. There's a great deal of information about the Student Wellbeing Service on RADA SharePoint, and students can self-refer or can ask any questions they want to ask by contacting us via the email wellbeing@rada.ac.uk. Thank you for listening and watching this video.